great. Well, thank you, everyone. And we do appreciate you coming to our last session. So today we have a didactic presentation. It's on continuous learning. It is our final presentation for this session. And Elena from Superior Health Quality Alliance will be providing this. And so Elena, if you want to get your slides up, and also if you have any questions during the presentation, just chat them in and we will answer them at the end of the presentation. And if there's anything that we can't answer, even for this session, we'll follow up with an email to everyone and help answer your questions afterwards. Again, if anybody's having any technical difficulties, you can always chat those into the chat box, and Elena can help out, or I'll be able to monitor the chat during her presentation and help out if you're having a hard time hearing or don't see the slides advancing or something like that. So with that, I will turn it over to Elena.
Thanks, Barb. So welcome to Fundamentals for a Culture of Continuous Improvement. This is our final session, session 6, and we will be focused on continuous learning and education. So to get started, our objectives for today will be to review when to use charts and tools, just kind of quickly going over what we talked about in the previous 2 sessions with some of those charts, understanding the importance of continuous learning, utilizing strategies to incorporate into your current practices, and then we'll learn about some educational opportunities to enhance your current staff's knowledge. So first, let's hop into that chart and tool review. So what I want to do in these next few slides is just quickly remind you of those things that I shared in the last 2 sections and give you a couple more ideas. So this first one is a run chart. This was talked about 2 sessions ago. It's again used when looking for trends or patterns in data. So for example, we are seeing this all the time with our COVID data at a state level, especially when you hear the governor talking about things trending up or trending down, and whether they relax restrictions or create new restrictions, they're using these run charts, right? So they're looking for these shifts and trends in data over time to make decisions like those. So for example, like I just mentioned, you could track the daily number of COVID patients in your facility, or you could even track the average length of stay by month to see if there's any trends happening that way. As a reminder, if you do want to utilize a run chart, you do need at least 12 data points to place the center line, which is that kind of average, the median. You can kind of choose between the median or the mean to place that line. And then once you get 20 to 30 points of data, you need to reevaluate that center line. Because again, a lot of those rules depend on crossing the center line or sitting on the center line. So again, if you want to review the run chart rules, you can check out session 4. As a reminder for the Pareto chart, this is used to identify areas to focus on. So this is great to use with qualitative data. So maybe you're going to survey patients on ways to improve satisfaction, and you'll get a bunch of different answers, and you want to focus on the one that frequented the most amount of those surveys. Or maybe you can survey staff on reasons they're apprehensive about the COVID-19 vaccine to really focus your education on what will impact the most amount of your staff. So you can see an example of a Pareto chart right over here. This one's focused on types of medication errors. So you can see the top 4 there are dose missed, wrong time, wrong drug, and overdose. So those are the areas that you'd want to focus on first in reducing those medication errors happening. And then you can kind of get to the other ones if there's still an issue. The next tool is a histogram, and this is used to recognize patterns in continuous data, things like time, weight, size, or temperature that can't be seen just visually on a table. You need to see the patterns of things and visually what they look like. So for example, this one right over here on the right, temperature checks on vaccine storage devices. So maybe you're going to look at what that looks like over time. And then finally, the scatter plot. This is used to test whether the performance of one factor is related to the performance of another. So for example, monthly healthcare associated infection index rates and hand hygiene compliance rates. So hopefully what you would see on this one would be more of that negative correlation, where monthly healthcare associated infections go down as hand hygiene compliance rates go up. And just as a reminder, negative correlation and positive correlation doesn't signify good or bad. That's just the way that the two causes or effects relate to each other. So that was just a quick review of the past 2 sessions. If you are interested, if you missed the last 2 sessions or you want a refresher, highly suggest checking those out. We'll make sure to include all the links to all 6 sessions in our follow-up email. But now we're going to hop into the importance of continuous learning. So continuous learning, when an organization commits to continuous learning and improvement, it creates and strengthens processes to promote transparency, reliability, and sharing among staff. The healthcare industry is continuously evolving. I think we've especially seen that in the past year or so when we were hit with COVID-19 and we needed to evolve and make changes quickly. So we always need to be continuously learning about new strategies and things that could keep us prepared in case we ever come across something like this again. And finally, continuous learning is just a great way to invest in your staff members. Sometimes there's not always the opportunity to provide big bonuses or promotions or things like that, but if you're able to provide an investment in your staff members' education, that can be invaluable. So what are some strategies for success? I want you to look at your organization and ask yourself these questions. Does your organization identify staff learning needs to provide safe care? Things like developing core competencies and skills needed for specific job roles, developing competency trainings and annual skills assessments, or creating learning feedback loops to assess the impact of the education. Does your organization provide orientation and opportunities for ongoing education to support learning? So that would be things like offering a variety of learning methods to provide education, establishing education expectations for continuous learning, or assessing the organization's education and training programs annually. And then finally, does your organization develop sustainability plans for project initiatives? Sustainability means that the process continues to work over extended periods of time as it was initially intended. By creating a sustainability plan, an organization is able to maintain the benefits of a program. So what should be included in a sustainability plan? Things like a process to evaluate effectiveness of education, including pre-post test measurements and training evaluations. That's going to be something kind of that we do after this. We'll be sending out an evaluation to all of you to kind of see how you like this format, how you liked what we presented on, all of those things. You can also set organizational goals using national, regional, and/or state benchmark data. You can identify and track measures to understand organizational performance. Oftentimes that will align with your organization's strategic goals. You can identify and prioritize areas to improve, and you can determine a standardized implementation process and ensure the key components are included within the spread of the intervention and create a process for monitoring over time. So those are all ways that you can set yourself up for success with continuous learning. So what are some educational opportunities outside of kind of what we talked about right here in this 6-week session? First, I'll go into some of these superior health offerings. So these are the things that I just know we have coming up very soon or that are already out that I wanted to just mention. The first one is through our independent approach. And if you're not familiar with what that is, that's a very self-guided learning style. So what we'll be doing is we'll be putting out action guides and toolkits and things like that, that you'll be able to just take, read over, and pull what you need from it and implement it in your own organization. So this first one is a foundation for action. And it's going to be a series on guidance for thriving in healthcare today. And the first one talks about supporting a safety culture, and it is an assessment, and it includes things like what I just talked about 2 slides ago. So if you do want to look at that and see and assess what your organization is doing, definitely check that out. Like I mentioned, it will go over some of those questions that I just asked 2 slides ago, but it's just an assessment to help you see where you're at. The next thing that we'll have are some additional structured collaboratives. The first one, as Barb has mentioned, is that using leadership, organizing, and action, or LOA, to build a coalition. That will be a similar style to this ECHO. So if you're interested in that, I highly suggest checking it out. I did put a link to where you can find all of our events earlier. I can put that in again. I don't know if I see that some chat just went in, so it might be in there again. And then after that, we will be having a clinic-focused self-measured blood pressure training that will start 2 weeks from tomorrow. Again, that one is pretty clinic-focused, but you're welcome to attend if you feel like that would be something that would be valuable to you. But just to let you know, it is pretty clinic-focused. And that one will be more of a straightforward training and not an ECHO format. We also suggest just taking what you've learned in this 6-week ECHO and use that assessment in the independent approach to see if there are areas for improvement. We'll have many more action guides and assessments like what I mentioned in the independent approach. If there are specific things you're looking for, or if you have any questions, you do have Barb and I's email address, and you can always reach out to us at any time to send us ideas for future ECHOs, action guides, webinars, sharing calls. You name it, and we will most definitely look into it. We want what we put out to be guided by your needs. If you have really liked this specific ECHO structure, let us know. We will be placing a link to evaluate the ECHO at the end of today's presentation. We'll also include it in the email that we send out. So feel free to give us some ideas for future ECHOs. Some other resources that are available include the IHI Institute for Healthcare Improvement. You can create a free account with IHI to have access to tons of great resources, and we highly suggest you do so. And then some other options. So consider certification. So there are a couple different ones that I list here, but I would happily hear from any of you that might be privy to some that I'm not aware of. The first one is through the National Association for Healthcare Quality, or NAHQ, and that one is the Certified Professional in Healthcare Quality. This is something that I know a lot of our staff are currently working on getting, so you might be seeing those acronyms after many of our names later this year, but this will help you demonstrate your competence in healthcare quality, distinguish yourself from other healthcare quality professionals, enhance your credibility, demonstrate your dedication to the profession, show your preparedness to improve outcomes across the continuum of care. The other one that I wanted to mention is a Project Management Institute, or PMI, Project Management Professional, or PMP. The PMP applies to anyone who helps bring a project to completion. So you don't already have to be a project manager, but if you're a part of any type of projects, that could be helpful to you. And then the last one I just wanted to mention is Lean Six Sigma certification. And this is a method that relies on collaborative team effort to improve performance by systematically removing waste and reducing variation. It provides a framework for overall organizational culture change. So those are just 3 that I'm aware of that I wanted to put out there to all of you. Again, I know that sometimes organizations have educational stipends or things like that. So these are some good things to look into. If you have access to those, they're a great way to build your knowledge that can make you more successful in your current role or give you opportunities to grow in your role. So are there any others that anyone's familiar with? I see we have some stuff in the chat. All right, awesome. Kim mentions that they utilize the AHRQ Patient Safety Questionnaire to condense survey fatigue in the middle of COVID pandemic fatigue. They elected to pull a key sample of questions from the AHRQ tool for this year's survey. Awesome. Thank you so much, Kim, for sharing that. We also have the CPPS, Certified Professional in Patient Safety. That's from IHI. Kim mentions another interesting idea for a collaborative. Yeah, after action discussion on the COVID pandemic related to our sites. Awesome. And does MPRO/Superior Health have resources for staff mental health following the pandemic? Yeah, I think we definitely, if we don't already. I know that we're planning on some things. I know we'll be having some calls focused on resiliency and things like that. I think there might even be a video out as well. So definitely check out our YouTube page.
Mhm. And on some of those past COVID calls, we did have one of our behavioral health specialists, Mia Croyle, talk about how to take care of yourself and how to take care of patients during this time. And she did do something about how to stay connected over the holidays. But I also think you're right, Elena, in our upcoming COVID calls too, we're going to be talking about some of those issues as well with staff resiliency and how to manage post-COVID.
But I think that can help us. Things like that are definitely things that we want to hear. I know at the beginning of this, we all talked about how we knew that there would be some PTSD from COVID for many of the frontline staff members. So we've discussed that in our previous calls as a team. So I think that could definitely be something that we focus on moving forward. So we appreciate all of those types of suggestions. So thank you so much for making them. So with that, that's kind of all I have for today. Feel free, if you think of any other certifications that you could share with the rest of the group, to pop those in the chat throughout the rest of today. And we'll be sure to share them, but I will be kind of passing this over to myself, I think. So as Barb mentioned, we didn't have a formal case presentation from any of you today, but we did create one that will be focused on creating a consumer and family advisory committee. So with that, I will be handing it over to Barb, who will be giving our case presentation today.
Thank you, Elena. So I always have to ask, can people see my case presentation now? Okay, great. So yes, I am going to be playing the role of Barb Link Quality Manager at all their community services. And what we're looking at is that our agency, we provide non-medical in-home services to older adults in a rural setting. And so we've tried at different times to develop a consumer and family advisory council. I know many people know them as patient and family advisory councils, say in a hospital setting or maybe a skilled nursing facility setting, but we decided to call it Consumer and Family Advisory Council. We want them to help with program development and evaluation. We really want to have our clients who participate in our services be members as well as their family members. And we really want them to help with evaluating the current programs, think about new program development. How can we reach out to other older adults within this rural community that we're set in, and then educational opportunities. So those are that's sort of our goal, or what we would see the Patient Advisory Council working on with us. So I convened a few of my coworkers to get started with this. I've got Sue, who's the Director of Care Management for our program. And so she really oversees all of the people who do assessments for getting into the program, provide services to the clients, and really coordinate all of their care regarding any of our programs at the agency. And then Jackie, she's a direct care manager. And then I have Lynn, who oversees all the programs at our agency. So we really have a goal of trying to convene the group by the beginning of April of this year. We're hoping that maybe by that time, things will have calmed down in our community regarding COVID, and people might be interested in, I think that's even another thing that I need to think about is, could we have virtual or call-in meetings, or would people feel comfortable meeting by then in person if we did social distancing and did some of those interventions like had masks and things like that. And we really would like to have 10 total members. We'd like to have 5 consumers, and then 5 family members. And they don't have to be necessarily related to each other, but we're sort of looking at the people who are actually using the services and then the people who provide assistance to them. And then, so our rollout would be by the end of January. We'd have things like job descriptions and orientation materials, and then set a date for initial orientation. And that goal would be sometime in April. And then we'd like to have at least 5 members recruited by mid-March, and then all of them recruited by April for the first orientation session. So are things going as well as planned? We're still in the planning stages, so not quite sure how to answer that question. But the issue is that some of the challenges that we've had in the past is we have developed all the materials and like orientation information, interview, job description, that sort of thing. Yeah, like an interview guide for people to interview some of the people who are interested in becoming volunteers for the council. But we have all of that information. But the last time we tried to do this, we didn't get anyone from our community to volunteer to become members for our Consumer and Family Engagement Council. So we really want to figure out how we can engage the participants at our agency, as well as any of their family members. We do have a few of those consumers who are, that we know are really engaged with our care managers right now. And so we thought maybe that could be one avenue to pursue. But when we've kind of broached this topic at a staff meeting, the care managers were really tentative because they thought that was kind of a conflict of interest. Like, oh, so we tell them that they can influence their services, but then we're the people giving them services. So they might be worried that if they don't join the committee, that they might lose their services. So we want to figure out a good way to address that and help them understand that really this is helping empower the clients to advocate and participate in our agency to improve the quality of the services they receive, as well as future programs. So with that, since it's in the very beginning stages, my questions that I had are that, has anyone ever really started to try and do a patient and family advisory council from ground up? And if so, what were some of the initial steps that you did for just even trying to recruit participants? And how can we work with the care managers to help increase engagement and some of those frontline workers that we really think have, you know, one-on-one outreach and know great participants who could really be wonderful volunteers? And how can we diversify our council to include a wide variety of consumers that we serve? So we're not getting all the people. We have a senior center, and those are very active older adults. They can still, you know, when we're not in time of, you know, limited access to our senior center, those seniors are driving and coming and participating. They're really very active. But we want to find some of those participants who maybe can't get out of the house so easily and are engaged in some of our care management and our chore service programs and that sort of thing. So maybe, you know, the wide continuum of older adults that we provide services for, we want to really get diversify that way, and then include their family members as well. So that's just some of the information. That's
Thanks,
about it.
Barb.
Yeah.
All right. Well, I just want to quickly provide a quick summary for everyone. Please, Barb, let me know if this is not accurate. So today's case presentation focused on developing a consumer and family engagement council for a community-based organization. The purpose for this CFEC is to gain input on program development, evaluation, and increase consumer participation. The presenter had difficulty in the past engaging volunteers to participate in the council. Is that correct?
Mm-hmm. Yeah, that's a nice summary. Yep.
Awesome. Thanks so much. So to get us started, I just want to open it up to the network. If you have any clarifying questions, we'll hold off on the recommendations to begin. But if you have any questions about what Barb explained, to get more information on her population or anything like that, feel free to ask those at this time.
Barb, it's Kim. What do you expect to be the product of this group's work?
So what I would hope is that they would be giving us feedback on our current programs. Do they find them beneficial? Do they think that there's challenges with them? I know sometimes that can open up a whole host of other issues if you get certain people who are, just complaining about services, and sometimes there aren't a lot of things that we can do, but we would like to have that feedback about our current programs. And then we do have the ability right now, we've received some grant funding for expansion of our programs. And so we're looking at really trying to target and get input as to what might be beneficial for expansion of our community services. And then we do have an educational arm where we're educating professionals in the community as well as our constituents or our consumers. So we would like to have their input on what are things that are topics of interest to them. If we are doing something for education to our care managers, what would they, if we gave them the curriculum for that education, what would they see from a participant's lens that we might be missing in that? And then I think there was one other area that I really wanted them. I know it's current programs, future programs, and certainly education for sure are the big things that I want to make sure that they be, and then just outreach. So if we feel that there's someone who can really speak to what it is as a participant in our programs, and they can talk to other senior groups or go to church organizations to educate them. We found that like actual participant voice really seems to lend a richness to when we're doing outreach to educate people about our services to get more participants.
I don't have a question specifically, except we have a situation that I could almost overlay exactly on top of yours. It's, and I don't think there's any other waiver representatives here, but the My Choice waiver program in Michigan does actively pursue participants and family members to join a group and meet quarterly to discuss exactly some of the things that you were talking about, as well as some specific issues like falls. And I'll just use that one as a common one. So this is of great interest, but unfortunately I don't have any. I'm waiting to see if anybody has any more ideas other than what we've already tried. So I'll just but as I'm listening to this, when I read it, it didn't connect. But when I was listening to it, I was like, that's exactly what we want we want participants, we want feedback from the community.
Thank you. Are there any other clarifying questions for Barb?
Barb, what kinds of feedback tools do you use for your current community programs in this scenario? I'm just looking at a potential intersection between, I was a recipient of program services and I filled out your satisfaction survey versus now I want to join a community group, and I'm going to tell you about that again.
Oh, well, that's a good question. Like, how can I make that different or more interesting to them? So, yeah, typically we have just a standard patient satisfaction survey that goes out, like, was the person timely? Did they answer your questions? Did just have to make this up. So I'm just trying to think, just your general, just sort of satisfaction. Did you feel like the service was appropriate and delivered as expected? And just some of those general questions. So, what I'm hoping from a patient, just to extend that a bit, to have a larger role of, before we even send it out, they would be reviewing that patient and that evaluation to see, is that written in language that even makes sense to you? How come we don't get a very good response when we send these out to people? How do you, really getting some of that nitty gritty information from the patient perspective or consumer perspective to really get added value, so we have a better outcome, so we have more people responding. I guess I could segue. We at Superior Health here have always been tasked on a little bit larger level to try and get patient and family engagement councils up and running. And I'm on that committee right now, so I'm kind of moving into a different hat here. So I guess I can take some of the things that we've done. So some of the things we're thinking about for our community organization, as I still stay in my mock role here, is to really engage the care managers. And I think if we are able to talk to the care managers in a way to help them understand that really, if we talk to consumers about this and really educate them that this is voluntary, they're not going to lose or gain anything from their services necessarily. Well, they could end up gaining because the services might be more tailored to what they're looking at, but we don't want them to feel coerced in any manner. So maybe if we had I'm just trying to think of if we had the care manager introduce it to them and talk to them about it, and we had a very good job description as to what that consumer would be providing to us. I'm hoping the care managers might feel more comfortable introducing it to them, because I feel like they have more of a personal relationship with our consumers. Because last time we just sent out a general flyer to everybody, said, do you want to just come and have your voice heard? And we got nothing. So I feel like more of a one-on-one interaction with them from a care manager that they know and feel comfortable with might engage them more. I think we also have to figure out how to help those care managers feel more comfortable talking to their clients and help them understand that this is really an advocacy role. We're empowering the clients for their voice and talk to them about how they're not going to lose anything, or help them feel not coerced. It's certainly, and nothing will change if they say no, but if they say yes, look at all the input you'll have on our organization to improve services for yourself as well as other community members. I know the other challenging thing that I just know in general with patient and family engagement councils, or even consumer councils, when you try and form them, is we ended up getting a lot of retirees from our organization. And it was sort of people who already knew about what we were doing, and they didn't really have that critical eye that we were sort of looking for. So really trying to find the whole continuum of people in our different programs to participate would be a strong goal of ours. Helping people who maybe don't have such great health literacy to attend, and help them feel comfortable, who they might be sitting next to somebody who has a retired nurse who wanted to be on the Consumer and Family Advisory Council, but help them feel that they have just as much a voice as someone who has a background in healthcare. So I think the other thing is being flexible, especially family members, and wanting that voice, and what time of day we would have it at, how we would have, I think interestingly enough, if people have the technology and we can support them with the technology, having Zoom sometimes is easier for people. People couldn't get out before to attend meetings in person. So I know there are some grants out there for rural communities now to get some connectivity, like through hotspots and things like that. And so we'd try and pursue that so we could have meetings that might be more accessible for people. Those are just some of the things I'm thinking of. Anybody else have any thoughts or anything?
I'm really hoping to hear. We tried pre-COVID. We were very successful with offering lunch and a short presentation, and then a discussion group, so that we would tell them what we would be discussing, a couple of different ideas, and then encourage them to come and give us their voice. Pre-COVID, that seemed to be working. The care managers, the care coordinators for the waiver gave us a list of individuals that they spoke with that said they might be interested. And then we did follow-up calls individually. And then we would invite them to the meeting. And that seemed to be somewhat successful. So we would get maybe 13 to 20 people out of 50 phone calls. And we did provide transportation for them. What's happened since, we thought maybe we would get a few more different people with the Zoom format, but in fact, we're getting one or two, if that. We're finding that our participants, which are, it's a Medicaid program, either don't have technology, don't have access to it, or don't have internet in a lot of the rural areas of Michigan, which is probably also true in, I'm guessing, in Minnesota and Wisconsin. So I don't, if anybody's having success with or ideas for getting the technology, we do not have any grants that we have access to or manpower to help the participants that would like to, but don't have internet. Although with the older population, we're, mostly I get, well, honey, I'm not interested in computers. I get that a lot. So they're nice about it, but hopefully when we get back to in person, it'll pick up again. But I'm really anxious to hear if anybody has any other ideas.
Thanks, Darlene. Yeah, we can move on to the recommendation phase. If anyone has any recommendations they want to give. I know there was one in the chat that I just want to mention really quickly. Lori mentioned encouraging to connect with local area agencies on aging to connect with family givers and older adults. And I also see there's one other one at North Memorial. We don't have a PFAC yet, hopefully on our strategic plan for 2021. However, another important group is the patient representatives. They know which families and customers can represent community views and give feedback. So thanks for adding those into the chat. If you have any others that you want to add in the chat, feel free, but you can also unmute yourself and speak up if you'd prefer to do that.
This is Kim. I'm wondering if there's an opportunity to look at the post-service satisfaction questionnaire and really open that up. So instead of make that like a pipeline that funnels information into, the group that you're trying to form. So open-ended questions, what did we do best today? Was there a service you needed we couldn't provide today? What is that? Make it more conversational, especially in these times where face-to-face is kind of limited. Secondly, I wonder if there's an opportunity to use your care management coordinators and put together like a performance improvement team among them to kind of, I know you said you wanted to do some education with them so they felt equipped for those, one-on-one conversations, but maybe they can actually work a little closer on improvement with their clients, and they may actually funnel them into wanting to participate as a representative.
Well, those are great ideas. And I was just thinking too that we've always done it as like paper mail out survey, but we've never ask the care managers to go out and use it like an interview, an opportunity. So take that evaluation and actually ask some of those questions. So I think that sounds like a great opportunity to incorporate more open-ended questions and then have them actually do it as more of an interview than just a paper evaluation. I know we wanted, maybe some of them might feel tentative because it wasn't, they have to share the information with the care manager. Maybe they weren't so happy with the care manager, but we could just test it out and see how it goes for a while. But I really do like adding the questions to the survey to get more information and see if then you review them and take a look and see if there's some potential there. I like that. Yeah. And I know, to go back to Darlene, I think when I've had other consumers participate, and they participated, say, by a phone call-in line, it's not quite the same to have a phone conference, and not be able to see the person's expression, or sometimes they feel tentative about sharing. So, you have to be very cognizant of who's on the line and trying to engage them and that sort of thing. So a phone conference line, even for people who don't like using computers so much, still has its challenges, but we could see if that would work too. When things open up again, I love the lunch and learn idea. I think that's great. I mean, I guess I started thinking, could I give them gift cards and see if, if they come to the meeting, then afterwards I mail them a gift card, but that's still not the same as lunch. Just has a joining feeling to it. You're eating food and people are coming together, and then you're having the meeting afterwards. I just really like that idea. It's just making me really miss those sort of things very much. So, but there's always hope. So when things open up again, I still like that framework very much, because they deserve something for their time. And that's a nice way to show them that, give something back to them too.
Barb, this might be, I don't know if this is a good question or not, but have you actually asked any of the consumers what it would take for them to be interested to be involved? Because we're talking from our perspective that I agree, lunch and learns, how Darlene articulates some of that. I agree with a lot of what she was saying, but sometimes what we think it would be a nice thing to do or whatever, to them that doesn't matter, and or they might have a totally different opinion on what it would take for them to be encouraged to be part of the group. I'm just trying to think of some of the groups I've tried to pull together over the years, and sometimes it's like pulling teeth, and these are supposedly topics that is their work. And I just know my one ongoing group, I need a co-chair, and I've been asking for 6 months and no one. And this group's been together for a long time, and being co-chair is super easy, and no one has come forward. So I finally now have to personally reach out and ask someone. And I'm sure now she will say yes, because I've officially asked her. But sometimes it also takes me back to my old days in fundraising. You can send out all the donation letters you want, but usually it's the phone call and it's that personal relationship that someone donates and or comes forward, even though they may have had good intentions because they saw your letter. And so I'm just wondering if there's more, but that, again, that's a personnel resource to have more on one interaction. And I understand that piece too, but to ask the consumers, what would it take for you to become involved, especially if there was a consumer maybe that had some challenges or some issues, and maybe they were resolved, to say, those are the types of things we want to talk about. So kind of how we resolved your issue, how can we resolve some other issues for people too?
Oh my goodness. Oh, I love that, Joanne. That's great. Yeah, ask them here, I want a patient advisory council, and I've decided what's most important for it, but I think I need to start with them. You're exactly right. That's yeah.
And I think tying that to the care coordinators or the care managers is really important, because they do have a relationship with them. And so if the care managers buy in or the care coordinators and they ask the individuals, that's when we really had our best results. So I love that too, Joanne.
Yeah. Great. Oh my goodness. Oh, anything else? Let's see, you're seeing in the chat here. Oh, people like the lunch and learn. Okay. All right. I think it looks like my goodness, we're down to like 3 minutes left. So I really appreciate everybody's input. I think that was very helpful. And just like with all of our previous sessions, some of those suggestions we will send out. We also have a patient and family engagement committee here, and we are putting together a action guide. It's similar to what you would think of as a toolkit, but it's more actionable with checklists and such like that. That hopefully within the next month or so, we'll be making that available for people. So there was quite a bit of interest today. That's so heartening for me. So that will be coming in the near future, sort of how to start a patient advisory council from ground up, the tools that you would need and how you would do that as well. So we'll be providing that in the not too distant future for participants. And so all of the suggestions for today, the didactic presentation, and yes, any of the information that was provided today, we will send out in our follow-up email, along with the link to the recording for the session, as well as we've done in all of our past sessions. So with that, I do really appreciate everyone's participation today. Thank you, Elena, for a wonderful didactic presentation. And also, again, this is our last session of this particular QI Fundamentals Echo. We really have enjoyed everyone. Thank you so much for all your input and insight and contributions. It really felt like people participated and were present in these sessions. And that's what makes an Echo format great, is the contributions from everyone. So again, Elena is posting the evaluation in the chat. And again, we really would like you to complete that so we can improve, and as well as hear as what might have went well for this session. And also that'll be put in the email we send out too, right? Yeah. So, and just a quick reminder, I know Alina mentioned this as well, that our Leadership Organizing and Action, or LOA Tele-Echo, which expands on the Healthcare Community Coalition concept and helps teach you how to form a community coalition regarding healthcare and improve health for patients involving a continuum of care concept. That's starting next week, Tuesday, January 19th. If you have not registered for that, you can just also send me an email and I will send you the link for registration. And again, I'm blink@mpro.org. You can just send that to me and I'll help you out. But we are almost at capacity for that. So if you are interested, please send me your information as soon as possible. And also from this Echo, we're not leaving you high and dry. If anybody has any questions about any of the sessions or any of the information we sent out, you can always contact me, Barb Link, at blink@mpro.org, or Elena at esmith@mpro.org. If you have any questions, suggestions, any input at all, we're willing to take that. So thanks so much for, you can use our emails for anything that you have regarding that. And I just want to tell you all, you've been a wonderful group and we've just really enjoyed this. This is our first tele-echo for this current contract under our CMS contract. And we hope you found something of benefit, and we really have learned a lot from you. So thank you all so much, and for everything that you're doing for the patients that we serve. So thanks everyone.